In about 30 years, we've seen the medical advancements in the way we treat HIV and AIDS. But why haven't our opinions of HIV positive people evolved in unison with our accomplishments in combating the virus? Why do we have such hostile response to HIV when it can be treated so easily? When did the social stigma begin and why it hasn't gone away? And these are not simple questions to respond to. My name is RV Cuarto, your HIV advocate, and would tell you insights on how we can break this stigma. But first, let us understand what is discrimination and what is HIV stigma. Discrimination is the behaviors that result from those attitudes or beliefs. HIV discrimination is the act of treating people living with HIV differently than those with HIV. And here are a few examples. A healthcare professional refusing to provide care or services to a person living with HIV. Refusing casual contact like touching the hands or like refusing to kiss someone because the person is HIV positive. And lastly, socially isolating a member of a community because they are HIV positive. And what is HIV stigma? It is a negative attitude or attitudes and beliefs about people with HIV. It is a prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. Here are a few examples. Number one, believing that only certain groups of people can get HIV. Like in the 80s, AIDS or HIV are only associated with gay men. But apparently it's not. Even children can get infected by HIV through breast milk or breastfeeding. Making moral judgments about people who take steps to prevent HIV transmission. And that is the reason why there are a lot of HIV positive individuals who are hiding themselves or refusing themselves to get the treatment needed for HIV positive. And also making people feel that they deserve to get HIV because of their choices. Let me also share you some stats. In January 2021, there were 819 HIV positive individuals reported to the Department of Health, HIV and AIDS, and Art Registry of the Philippines, or HARP. And globally, there are 37.7 million people living with HIV in 2020. And these numbers are relevant as to why we need to understand this piece and help fight the stigma. In about 30 years of medical advancements in the way we treat HIV and AIDS, why we are still experiencing the stigma? And that is a quite big question to ask today. But for now, I just want to have a show of hands of emoji for the next few questions. You can just hit the emoji button at the bottom of your app. How many of you in here were aware that with treatment, those with HIV not only fight off AIDS completely, but they live full and normal lives? Anyone? Okay, I can see one, two, all right, five people. Okay, eight people. Great. That's good. All right. Next question. How many of you here are aware that with treatment, those with HIV can reach an undetectable status, and that makes them virtually uninfectious? Okay. All right. Thank you. I can see a couple of emojis right now. Good. And last, how many of you were aware of the pre and post exposure treatments that are available that reduce the risk of transmission by over 90%? Anyone? No one is raising their hands because we're talking about numbers, right? Oh, I see. One, two, three. Here you go. Great sets of numbers. Thank you so much for that. And I don't want you guys to think that I'm downplaying the danger of the virus. And I am not ignorant of the past of the AIDS pandemic, but I'm trying to send a message here. I want to send a message that there is hope for those infected, and HIV is not a death sentence. But where are these people living with HIV? Why haven't they been vocal? Where are the stories? Where? The simple answer is fear, stigma, and shame, right? The fear of how others perceive us when we're honest, it keeps us from doing so many things in our life. To face social scrutiny and ridicule is the price that we pay for transparency when you can effectively pass as someone without HIV, right? Because after all, there are no physical indications that you have the virus. There is always safety and invisibility. Do you guys agree? There is always safety and invisibility. Like less talks, less mistakes. No one would know if I wouldn't speak up, right? HIV stigma and discrimination affect the emotional well being and mental health of people living with HIV. People living with HIV often internalize the stigma and experience and begin to develop a negative self image. It is true. And they may fear that they may be discriminated against or judged negatively if their HIV status is revealed. And that is a fact. Let me tell you a story. My childhood best friend, who was in his late 20s, was sexually active. Yes, it is. He generally took precautions to minimize the risk that sex carries, but he had unprotected sex. Not once, not twice. And I should know because I'm his best friend. Fast forward to 2018, I've learned that he's been in and out of the hospital, and his family did not share any diagnosis but of pneumonia and weakened immune system. In less than a year, he passed away. One of his closest friends shared his photo, and I can no longer recognize if it was him. It's too far from the looks of my best friend. From head to toe, he was covered by a worst case of psoriasis. And my friend told me that he can't even open his mouth to eat. My friend was a victim of the stigma and was so scared to get tested, scared of how cruel the community would be if he knows his status. And I'm sure many of you can relate to this situation. It is not just him who experienced the same exact thing, but most of you. And even for myself, who is not infected by the HIV, I felt bad for I have not done anything to save him. And I want to dedicate this speech for him, to my best friend. Even I wasn't able to save him, I hope that this platform and this opportunity can open a lot of minds and can help save someone who's scared of getting tested and someone who is hiding in the closet. And you guys might be wondering how you can address an issue as complex as HIV stigma. To be honest, it is not as easy as you can imagine. It won't be an overnight change or solution. But there are many small things you can do that will make a big difference. You also need to understand that HIV stigma happens in a lot of scenarios, like in families, with partners, with friends, and the community, and in the workplace. And it all starts with you. If you want to be an advocate, if you want to join the crusade in fighting the HIV stigma, you have first to, number one, educate yourself. Education is number one. That is our number one weapon to fight the HIV stigma. Learn the HIV basics, the risk and prevention, and you can also learn how to stop or end fight the HIV stigma. There are available resources you can find at Center for Disease and Control and Prevention. The website is cdc.gov. We will share that on my Twitter account after the session. This will also help you how to talk about HIV and to avoid the stigma. And keep in mind that the words we use matter. And that is part when you learn the HIV basics. There are certain words that we can say and whatnot. Second, talk about HIV. This is not something that we have to be ashamed of talking. And thank you for TED Speaks for allowing us to discuss HIV on this platform. Talking openly about HIV can help normalize the subject. It also provides opportunities to correct misconceptions, the myths, and help others learn more about HIV. But be mindful of how you talk about HIV, again, also with people living with HIV. Apart from learning and talking, we have to make sure that lastly, we need to take action. We can all help end HIV stigma through our words and actions in our everyday lives. You don't have to be an expert. You don't have to be a doctor. You don't have to be an expert. Any one of you here listening, any one of you can be an advocate to help fight the stigma. Lead others with your supportive behaviors. We can use our platforms to voice out our advocacy and help end the stigma. Use our social media accounts. Periodically post educational stuff about HIV, about AIDS, about the stigma. That can really help amplify the cause and advocacy that we're doing, that we're doing not just here, but the whole world is working on ending the stigma. Please take part and please be one of us. If you are a person living with HIV and asking where you can find support, do not worry. There are plethora of help and support you can get here in this country. Number one, we have a law that protects PLHIV. Quoting the Republic Act 11166, also known as the Philippine HIV and AIDS Act of 2018, it is an act strengthening our country's comprehensive policy on HIV and AIDS. This act would protect PLHIV against discriminatory acts and practices in the workplace, educational institutions, including travel, hospitals, and more. And any person who violates this act shall suffer 5 years of imprisonment or fine of at least 5 million pesos. And there are also non-profit organizations that supports PLHIV in the Philippines. These are groups or organizations referred by UNAIDS. You can find them on Facebook and Twitter. The first one is the Red Whistle, Pinoy Plus Advocacy Pilipinas, and PLHIV Response, that you can also DM PLHIV Response via Twitter if you need help or someone to talk to about your situation as a PLHIV. Apart from that, there are sites that can help educate yourself with HIV basics and fighting the stigma and be one of the advocates. First off is doh.gov.ph. That's our local Department of Health website dedicated to HIV AIDS discussion or FAQs. Also, a national website called hiv.gov for HIV basics. Center for Disease Control and Prevention website, again, that's cdc.gov. And if you want to get tested for free in the Philippines, please visit loveyourself.ph. Folks, if any of you or anyone you know is dealing with HIV, or if you want to see what resources you have in your community or simply educate yourself, you can check the sites I've shared on the pinned post on the top. And you're also more than welcome to find me after this talk. I'm more than happy to talk with you. And before you guys leave this space, I want to leave you with few thoughts. There is no voice too small. Remember that. There is no voice too small. Any one of you can help fight the stigma. Through our voice, we can alter the lives that we encounter for the good, and they in turn can take that momentum and push it even further. And I would like to commend our PLHIV friends who are voicing out their status, who are posting their status and their profile and sharing their stories to people and inspiring people living with HIV who are under the closet and people who doesn't know or fully understand what HIV is. Keep up the good work, guys, and that's what we need right now. Through our voice, we can make a change. And don't forget, when you think about HIV and when you see or met someone or learned someone who is an HIV positive, see the human through the disease. When you find yourself thinking, think son, daughter, brother, a father, or maybe a mother. Think of a friend. And most of all, think human. Seek education when faced with ignorance. That is number one. Always be mindful and always be compassionate. Let us all fight to end the HIV stigma. Guys, are you ready for it? Thank you and have a blessed evening.